Today I will be talking about how exercise affects older people with HIV. HIV causes AIDS and interferes with the body's ability to fight infections. The CD4 to CD8 ratio is the ratio of T helper cells, the CD4, to cytotoxic T cells, the CD8. This ratio in the blood of healthy adults and mice is about 2 to 1, and any altered ratio can indicate disease relating to immunodeficiency or autoimmunity. HIV infection results in a decline of the immune system through the depletion of the CD4 T cells. From the initial infection, the virus continues to replicate. HIV destroys CD4 T cells, which are the white blood cells that play a large role in helping your body fight disease. The fewer CD4 T cells you have, the weaker your immune system becomes. You can have an HIV infection with few or no symptoms for years before it turns into AIDS. Sometimes the CD8 T cells fails to produce a cytotoxic molecule, perforin, which it uses to kill virus-infected cells. Without helper T cells, which slowly disappear during the HIV disease, the CD8 T cells are unable to keep up with the increasingly diverse population of HIV inside the body. The virus can be transmitted through contact with infected blood, semen, or vaginal fluids, and within weeks of the HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue, and recurrent infections. As of now, no cure exists for AIDS, but there is an antiretroviral therapy which dramatically slows the disease's progress and prevents secondary infections and complications and prolongs one's life. Older adults have an increased susceptibility to infections secondary to a delayed immune response, which is a hallmark of aging and may be increased in HIV infected patients. Older Americans are more likely than younger Americans to be diagnosed with the HIV infection late in their course of disease, meaning they get a late start to treatment and possibly more damage to their immune system. These late diagnoses can occur because healthcare providers may not always test older people for HIV infection, and older people often mistake the HIV symptoms for those of normal aging and don't consider HIV as a cause. We have learned that HIV and aging have a lot in common. Both cause inflammation and a weakening immune system, and both are associated with high levels of depression and isolation, which lead to people skipping their medication, which in turn aggravates all of the other diseases. Older patients are at a higher risk for diseases and illnesses, and as stated by a New York Times journalist, I think we were so focused in on just controlling the virus that we started to take our eye off primary care issues. We need more aggressive management, understanding that these patients are at a higher risk for heart disease, for stroke, and for neurocognitive decline. We need to be aggressive because there are things we can do now that will allow them to age healthily into their 80s and 90s. The good news is that people with HIV are living longer, healthier lives if they are on treatment and achieve and maintain a suppressed viral load. However, with this longer life expectancy, individuals living with long-term HIV infection exhibit many clinical characteristics commonly observed in aging, which include multiple chronic diseases or conditions, the use of multiple medications, changes in physical and cognitive abilities, and increased vulnerability to stressors. HIV appears to increase the risk for several age-associated diseases as well as to cause chronic inflammation throughout the body. A person can have HIV and not know it. Some people have flu-like symptoms when they first get infected with HIV, but some people have no symptoms at all. The flu-like symptoms include sore throat, swollen glands, muscle aches, skin rashes, nausea, vomiting or diarrhea, and night sweats. There is no cure for HIV, but with proper care and treatment, people living with HIV can avoid getting AIDS and can stay healthy for a long time. It is important for patients to get treatment for HIV and to take their medication the right way every day. People who take their medication also reduce the risk of transmitting HIV to another person. HIV treatment is very important. People who take their medication live nearly as long as someone who is not living with HIV. Treatment can help reduce the level of HIV in the blood to undetectable levels. When treatment makes HIV undetectable, the possibility of spreading the virus to a sexual partner becomes very low. This is known as treatment as prevention. And as mentioned earlier, the ART treatment, also known as the antiretroviral treatment, the drugs work not by killing the virus, but by targeting and blocking the different stages of the virus's life cycle. And by doing so, the virus is unable to replicate and make copies of itself. At the start of the epidemic, more than 30 years ago, people who were diagnosed with HIV or AIDS could expect to only live 1 to 2 years after that diagnosis. This meant that the issues of aging were not a major focus for people with HIV disease. Older adults with HIV make up 60% of all people living with the virus in the United States. It started spreading in the 60s, but spread like wildfire in the LA, San Francisco, and New York City regions in the 80s due to the HIV epidemic. Many of them were diagnosed with HIV in their younger years. However, thousands of older people get HIV every year. For example, people living with HIV are significantly more likely to develop cardiovascular disease than people without HIV. On top of that, aging is also a risk factor for cardiovascular disease, and this is just a double whammy. Older people living with HIV also have an increased risk for dementia, and despite the median age of 58, older Americans with HIV are more likely to exhibit characteristics of people in their 60s, 70s, or even 80s. Regular physical activity and exercise are part of a healthy lifestyle for everyone, including people living with HIV. Physical activity can help boost one's mood, sharpen their focus, reduce their stress, and improve their sleep. It is very important they talk to their healthcare provider to clear them for exercise. People with HIV can do the same exercises as people without HIV. According to the ACSM, exercise for more than 90 minutes in healthy older adults can cause elevated levels of plasma concentrations of pro and anti-inflammatory cytokines. Exercise also increases the natural killer cell function, which targets HIV-infected cells in the body. The natural killer cells are the most responsive immune cells to exercise. Moderate physical activity can improve many immune parameters, reduce the risk of acute infection, and combat metabolic abnormalities. As people with HIV age, alternative therapies such as nutrition and physical activity may help with medical management. Exercise helps build muscle in places where fat was lost, and aerobic exercise increases the CD4 counts. Resistance training also helps increase their strength, improve their physical fitness, and reduce their upper and lower limb skin folds. Resistance training is also associated with an improvement in the CD4 and CD4 to CD8 counts in HIV positive elderly patients without significant side effects. Exercise is beneficial for older adults with HIV because it decreases the development of other illnesses and diseases, it increases their number of killer cells, it increases their quality of life, and it helps with their mood and daily living, and it may allow the individual to be living independently for longer. Thank you for watching.